Hi, I'm Tristan Minahan, and I'm going to do a speech over premature birth and labor. Preterm birth is any birth that occurs before the 37th week of pregnancy. It is the cause of many infant deaths and lingering infant illnesses in the United States. Every pregnant woman needs to know about preterm labor and birth, why it happens, and what she can do to prevent it. Preterm birthing occurs about 12% of all the pregnancies in the United States, often for reasons that we're not quite sure of. A normal pregnancy is usually about 40 weeks, but 38 to 40 weeks is considered normal. That amount of time gives the baby the best chance to mature fully and be healthy. A pregnancy that ends between 20 and 37 weeks is considered preterm. And all the preterm babies are at a significant risk for health problems. The earlier the birth, the greatest risk you have. You might have read in newspapers about babies who are born really early and do very well, but it's important for you to know that those babies are the exceptions. Babies who are born very preterm are at a very high risk for brain problems, breathing problems, digestive problems, and death also in the first days of life. Unfortunately, they are also at a high risk for problems later in their life, which they can have delayed development, cognitive abnormalities, and the effects of premature birth can be devastating throughout the child's life. The earlier in pregnancy a baby is born, the more health problems it's likely to have. Today I want to inform you of reasons why premature labor might occur and how premature infants are affected by early delivery. Also, I would like to inform you of ways to prevent premature birth. There are several reasons as to why delivery of premature infants occurs. The pregnant mother could have anatomical problems, such as problems with her cervix, uterus, or placenta. She could have chronic health problems, such with her blood pressure and diabetes. She could be underweight before pregnancy, and also obesity is another cause. She could have physical injury during her pregnancy. And also, when you get pregnant right after having birth, that's another cause. In some cases, many women who have premature infants have no risk factors at all. When a woman has problems with her cervix or uterus, as the pregnancy progresses, it puts too much pressure on the cervix and it causes early dilation. And the uterus might also not be able to stretch anymore for women who have problems such as a T-shaped uterus, which are more prone to miscarriages and preterm labor. The women who are at the highest risk are those who have had a previous preterm birth. Those pregnant with multiples, such as twins or triplets, because the uterus simply can't stretch that far. And once again, those with cervical and uterine abnormalities. Because preterm labor can occur to any woman, it is important that they know the risk and the signs and symptoms of preterm labor. So it's very important that you keep in contact with your medical provider, and if you have any signs of preterm labor, you need to contact them quickly or go to the emergency room. Other factors that cause preterm labor are receiving late or no prenatal care at all, smoking during pregnancy, alcohol and drug use, stressful life events such as a death in the family, domestic violence, or even long working hours which require you to stand up for a long time. Besides external factors, the mother's age can also have an effect. Women who are under the age of 17 and over 35, along with women of African American descent, are at the highest risk. These reasons remain unknown. In many cases, women who are given drugs to stop the labor process, and those women remain on bed rest or in the hospital for the remaining of their pregnancy. For others, the labor is just completely unable to be stopped, and the infants end up being delivered early. Depending on how early the infants were delivered, some of them remain in the NICU, or some of them are able to be discharged home with their mother. Infants which are born at 32 weeks and beyond have a much lower risk of developing complications, while infants born before the 32-week mark have an increased risk of complications. Micropreemies are known as the infants who are born at 23 to 26 weeks and have the highest risk of them all, and are not only at risk for health complications, but even death. Infants who were born at 34 to 36 weeks make up the majority of the premature population at 70% of the premature births. Infants between 32 and 33 weeks make up 12%. 28 to 31 weeks make up 10%, and those which occur before 27 weeks make up less than 6%. Infants who are born after the 34 weeks usually require just a little oxygen and a little help feeding. They have not yet acquired the sucking reflex, so a feeding tube may need to be placed into their stomach to give them their nutrition. Jaundice is also a problem, but that can be solved with the Billy Lights. Oftentimes they are released a few days after their birth and have no future complications based on their prematurity. The earlier births often have infants who have complications through their life, such as autism, cognitive disabilities, delayed growth and development, immature immune systems that can last throughout their life. More severe problems are cerebral palsy, short life expectancy, and death can occur soon after birth. Premature infants also have a higher risk of sudden infant death syndrome, so it's important that they remain on their backs when they sleep. These severely premature infants are placed in the NICU, also known as the Neonatal Intensive Care Unit. They're placed on ventilators, which help them breathe, because their lungs are not mature enough to do so on their own. They have feeding tubes placed in their stomach to provide their nutrients, and there's monitors and they have IVs, which they can get medication. Some of these infants continue to grow and have complications as a result of how early they were born. Others continue to grow and thrive. I would like to share a little story of a girl named Bella. A friend of mine who was in nursing school with me, she was pregnant at the same time that I was. She was due February 22nd and I was due February 9th. On November 18th, her little girl Bella was born. She was 26 weeks pregnant, weighed 2 pounds 2 ounces, and 14 inches. She remained in the NICU for 3 months, and luckily, she was one of those lucky preemies who has no problems at all, no delays in growth and development, and is ahead of several of the infants that are at the normal age. Unfortunately, not every premature infant is as lucky as Bella. And that's why it's important to inform you on ways to prevent preterm labor. One of the most important things that a woman can do is to seek early prenatal care. These visits are important because they monitor the progress of the mother as well as the fetus. They usually can catch any complications that might arise during the pregnancy, and they can be treated. Other important ways to prevent having a premature infant are managing your chronic health problems such as diabetes and blood pressure. You can do this by eating nutritious meals throughout the pregnancy. The mother also needs to have an increased intake of folic acid, calcium, iron, and remember to take a prenatal vitamin daily. A problem which seems to be increasing in the United States is the use of drugs and alcohol during pregnancy. The use of these substances during pregnancy can result in fetal alcohol syndrome, physical dependence, and brain damage when the baby is born. Many women also think that smoking does not have an effect on the baby, but that is not true. They can develop breathing problems from not receiving adequate oxygen through the placenta, and also smoking increases the risk of preterm labor. More simple things to control while you are pregnant include regulating your activity, managing stress, and taking care of your teeth. Women who have jobs which require them to stand constantly throughout the day have increased risk of preterm labor than those who are allowed to sit or have frequent rest periods. Stress is another cause of preterm labor, and it can be hard to manage during pregnancy, seeing as in itself it's a stressful time. However, it is important for the mothers to relax and just have a quiet time every day. Most importantly, if you have a history of preterm labor or risk factors, it's important to see your doctor regularly. If any symptoms of preterm labor are occurring, do not wait to see if they subside. Contact your health provider immediately. It could potentially be stopped and give your baby a longer time in the womb. To conclude this speech, I just want to remind you that there are many reasons and risk factors for preterm labor. If you have any of these, stay in close contact with your doctor. Do not ignore any signs that you are uncomfortable with. There is a big difference in an infant born at 25 weeks compared to one born at 25 weeks. One can go home with their parents while one will end up in the NICU for a few months. Prevention of preterm labor is possible if you Frequently visit your doctor, manage your health problems, eat healthy, quit smoking and drinking, rest often when you can, and make sure you get to relax. Lastly, remember that each day in the womb is a higher chance of a happy and healthy life for all the babies in this world.